Hi. Suppose I told you that the COVID vaccine has just been found to reduce the risk of strokes and acute myocardial infarctions. Would you believe me? This could be another Viagra, could it not? Something that has incredible effects way beyond the immune system. How can it be explained, you may ask? Now, you can call me a skeptic, but if you suddenly told me that smoking actually reduces your risk of cancer, I'd say, hold on, I got to look at that because that doesn't fit in terms of my real world experience. Similarly, for that evidence to come forward in a big study, and I mean, I'm talking about 45 million people across the UK, that got me thinking, how is that possible? So I'm going to give you a little bit of insight, and you'll find the link to the paper in the description. Remember, subscribe. There is a button on your screen that will be in the bottom right hand corner for you to be able to subscribe. And I have links to critically this newsletter, and you'll get a free ebook on nitric oxide. Sign up, join us in this community where we can actually really look at and analyze some research in a far more objective view. So when I'm speaking here, I'll have to be very gentle with what I say. Additionally, coming up in the next week, depending on when you're watching this on a Thursday, please remember that we are navigating the COVID storm. I'm coming up with what I think could be practical therapeutic options for people to use. Join us. It should be interesting, valuable concepts that I'm sharing here. The link again is in the description. But let's get back to this study. When I saw this, I thought, really? We're not talking about that there is no significant risk of clotting events after the vaccination. The study's actually saying that the risk is reduced. The risk is reduced. I mean, from a clinical point of view, that doesn't fit with what I observed. And I'm thinking to myself, how in the world can that be explained? So let's take a quick look here at this paper. So this was only just published 31st of July, depending on when you're watching it. And they were looking at the study of cardiovascular safety of different COVID 19 vaccination doses across 46 million adults in England. Now, what I'll tell you is that this information is actually quite valuable to analyze. So, I have already taken the supplementary report. It has a huge treasure trove of data that one can then try and go through. And now that we have the power of artificial intelligence, which it would become my statistician, I'm not a statistician, you can now really dig through this in a way that will make sense for what it is that you're seeing. So this is part of the issue, is that I don't for 1 second think that that makes sense. Now, you have to remember, so they were saying that there is a lower risk of stroke in the vaccinated cohorts. What is interesting is that even though loads of people were being vaccinated at the time, this is what was happening. I've gotten this from Statista. And this was just looking at, it gets the data from the Office of National Statistics, but number of inpatient episodes with a main diagnosis of stroke in the United Kingdom, looking from 2011 to 12 all the way to 21 to 22. And you can see here that there's a gradual increase over time. And it peaks here. This is about in 2019, 135,000, 670 in 2019, 2020. And then it drops off to 128 when people were stopping going out and there was lockdown. But then in 2021, it jumps to the highest level to 136, 839. So it goes from 135, 670 to 136, 839. That's an extra more than 1,000 strokes in that year compared to 2020, 2021. So that for me is fitting with the clinical picture. That's what we were seeing. We were seeing lots of patients having strokes. We didn't know necessarily what the cause of it was. And this is part of the question. I thought that at that time we really needed to dig into that data, but you need big data in order to analyze it. But strokes were increasing. And as far as I can remember, I don't think this was in the unvaccinated who were suddenly getting random strokes. Now, if somebody had severe COVID 19, they could have a stroke. But in the context of just getting a stroke, it didn't fit with the real world evidence. So when I see this kind of data, I, just being a skeptic, start to question because, I'm skeptical. Things have to be convinced. As I said, if you told me that suddenly smoking reduces cancer, I'm not going to say, wow, peer reviewed paper. I'm going to say, no, show me that data. Let me look at it. And now that we have AI, I can go through it in detail. I'll show you some clips of it in just a few minutes. But I just highlighted here again, and I'll add this in. So this again is the paper, and you can see here it highlights. So it's a big study. It highlights here that the incidence of common arterial thrombotic events, mainly acute myocardial infarction and ischemic stroke, was generally lower after each vaccine dose, brand, and combination. I mean, wow, this is suggesting it's a new Viagra. Anyway, down here, these findings support the wide uptake of future COVID-19 vaccination programs. I'm beginning to think you got to have this in a paper in order to get it published. So the options that I thought about here, and this is just me thinking, could it be that the researchers looked at this data and they thought to themselves, this doesn't make any sense, but we need the public to be aware of this. So let's just put it out there for people to analyze and tear it apart, because I'm trying to see if I can make any logical sense as to what that means. And I'm going to show you now in the context of the supplementary report. So in the supplementary report, and this is really important stuff when it comes to analyzing the data. I'm just going to show you just in a second what it is that I was looking at in this supplementary report, and I started off with the vaccine that I know is associated with clotting. That's the Chadvax, or the AstraZeneca vaccine. So my starting point is, okay, this vaccine has been taken off the market. AstraZeneca completely pulled it. They say for financial reasons. It's no longer being used because there are concerns about the risks, especially in younger people, with regards to specific kinds of clotting events. So if you were to tell me that that vaccine protects against clotting, that would make no sense whatsoever. So that's how I started off by analyzing the data. So here is what I just started doing. And again, as I said, I'm just giving you snippets here because this will take some time to go through this data. So as I said, this is supplementary table 8, hazard ratios for individual arterial and venous thrombotic events for the Chadvax or the AstraZeneca. Now, hazard ratios mean that the risk, if it's 1, it's equivalent to normal. If it's less than 1, it's a lower risk. And if it's higher than 1, it's a higher risk. So as we go down here, what you can see is for composite arterial things, it's 0.9. That means it's suggesting that in week 1, after getting the first dose, you straight away have a lower risk of having an arterial event. But notice that this risk very quickly starts to rise to 1.26 by week 13 and 1.32 by week 25. So, what that tells me is that this number has got to be wrong. It can't be right, because if it's protective in the first week, why would it suddenly increase the risk in the weeks after? So I know that point 0.9 is probably likely to be wrong. It's probably going to be 1 point, maybe 1.10, and then everything else continues to rise over here. But this is what I mean is this data is very useful to see the trajectory of conditions. And you can see here in each week that risk is rising up to week 25 to 26. It's the same here with ischemic stroke. Week 1, they would be saying that after you got the first dose, your hazard ratio in week 1 was less than normal. But by week 2, it was higher and continued to rise by week 25. That makes no sense. The only one that is closer to reality, which is that isolated venous thrombosis, these venous problems here, 1.39 in week 1, and then it rises to 6.08, then 4.09, then starts to tail down. So it shows that by weeks 2 to week 3 and 4, that's where the peak incidence of the complication would lie. But in reality, this is unlikely to be 1.39. Again, it would be too low with a hazard ratio needing to just be above 1. Mesenteric thrombus, 0.64. So they're saying that this vaccine that is known to be associated with clotting protects you in the first week, but not the second, third, 5th to 12th, 13th to 24th, weeks 25 to 26. That makes absolutely no sense. What it means is the starting point was wrong, but the trajectory is right. And you can see in every condition, this trajectory is rising. Probably the only one where you see a rise and fall, look at this one, myocarditis, higher in week 1. That makes sense. But in week 2, it's 0.61. So I know that it's not going to be protective against myocarditis in week 2. So what it means is that this number should probably be at least 1 or above 1. So this pushes this number up and all the other numbers. So you can then work out a trajectory as to how things work. That's what I'm trying to do when I said that I'm trying to piece things together. So it still is very valuable data, 45 million people. The question is, how do we then break it down to make sense of what has been? Here is a historical context, I think, because people may be asking, well, why is this kind of research coming out now? You know, we are 4 years, well, 3 years down the line. If this has this kind of effect, what we should therefore be doing is using it instead of cardiovascular medication. You don't need aspirin anymore. You just need a vaccine to stop you getting a heart attack and stroke. And it doesn't seem to come with a bleeding risk. That's incredible. This is better than any drug. As I said, I'm very skeptical. I really don't listen to phone scams either. So the point being is that those things don't make any sense. The question is, how can we take this data to make sense of what really has been occurring? Now, follow this because, again, right before I started this, I thought to myself, this has got to have happened already in history. And so I did find that. Here we go. So, this is the consequences of industry relationships for public health and medicine. And what they realize here is inventing conflicts of interest, a history of tobacco industry tactics. What was happening is that in the 1950s, there was a close link being promoted by the scientific and medical community that there was a link to smoking and cancer. And this caused big issue. So as I said here, by late 1953, the tobacco industry faced a crisis of cataclysmical proportions. Smoking had been categorically linked to the dramatic rise of lung cancer. And although health concerns about smoking had been raised for decades, by the early 1950s, there was a powerful expansion and consolidation of scientific methods and findings. So, in the past, you can see that at that time, the tobacco industry had a big problem with regards to what the science was showing around cancer. So, what did they do? So what it says here, and this is now they're saying that this is now a historical account, so we can look at it far more objectively. So what the industry then did is that they realized that there was a problem with regards to science looking at the link to cancer. So under the guidance, so this is where Hill, one of their senior, I guess, CEOs of the industry, he said that simply denying the scientific facts would be a losing game. It would not only smack of self interest, but also ally the companies with ignorance in the age of technological and scientific hegemony. So he proposed seizing and controlling science rather than avoiding it. If science posed the principal, even terminal threat to the industry, Hill advised that the company should now associate themselves as great supporters of science. So they would embrace the scientific community and therefore control the narrative. I can only think that this is what is going on at the moment because the uptake is so low. The world has gone in the completely opposite direction. And how do they reverse that trend? How do they rebuild the trust that they need? Come up with the science, make the science sound great, that, everything is fine. And I can only think that this is what is happening. But the reality is that we have very serious issues in front of us because, as I said, I think that there are issues, as I said, when you look at the trajectory of all these thrombotic complications, it rises over time. There are only a few of them that rise and then fall. And so my big concern is that what happens when you have a situation where you have recurring infection, which triggers the immune system, and the vaccination on top of it, which has been immune primed. I am worried in this situation that we are then going to see significant rises of these kinds of thromboembolic complications. And this is what is happening. And there is not enough of the scientific response to try and address this. Instead, the scientific community seems to be saying, based on this kind of paper, don't worry, this is great. Everything is okay. Actually, you don't need to be concerned. Everything is under control. And if you are vaccinated, you are fine. I am worried about that kind of science because the reality is that it is doing dangerous, detrimental damage to the whole medical and scientific industry as a whole, where people no longer trust it. And that's very, very serious. That is huge consequences for that. And so I can only think that we have to keep asking the questions. We have to keep calling it out. It's inconvenient, I can understand, but we can't afford to miss what is in front of us just because of the financial conflicts of interest that exist around the health, medical, and scientific industry. So, as I said before, my hope is that now that I have got the supplementary report, which has huge amounts of information that can be analyzed, what we can then do is really try and make sense of what the longer term risks are with regards to what is happening with the population. So, again, as we close out, remember, join us for navigating the COVID storm, therapeutic options. This is exactly why I'm looking at it. How do we negate some of these thromboembolic complications that are likely to be occurring after recurrent infection on top of immune priming from vaccination? That's the COVID storm that I'm worried about. And if you are interested, please join me then. So remember, as we close out, click on the subscribe button, look in the description, join us in this journey of science and questioning, and let's see if we can make a difference in the long run. Have a great evening.